This video is about looking up the background for a slightly less known person who's a subject matter expert from the 1960s on a specific incident, or not. Donald Teel Curtis is a former dentist from Amarillo, Texas. That's his primary designation recently. He had graduated from Baylor University School of Dentistry at one time, which sounds expected, but was specialized in oral and maxillofacial pathology and surgical activity. Maxillofacial is anything associated with or close to from here, basically from here forward, and from here halfway or all the way up in the eye sockets down to below the chin, and involving the throat. This is, you're going to have to look this up on Wikipedia for any kind of fine-tuned definition, but that's generally what it is. But that was as of November of 1963. His first year of his residency was for, 2-year residency, as a oral and maxillofacial surgeon in his medical residency of 2 years. He was in the first year of it in 1963 at Parkland Memorial Hospital, Dallas, Texas. On November 22nd, he was at the neighboring clinic associated with that hospital, and on his way from that building to the main hospital's cafeteria area. Presumably this was his lunch break, which, it's lucky if you get one sometimes at a hospital. He was redirected by a police officer when he was asked, "Are you a surgeon or a doctor or whatever?" and redirected towards the trauma room area. Trauma room number 1. He saw a man who was being treated laying on his back. He was having difficulty breathing, and a doctor and nurse, the other 2 people besides him, that's 3 so far in the room, the doctor and nurse were attending to the individual, the patient, getting him an airway established underneath the voice box. From here down, the airway is in the front, and behind it is how you swallow food. And as you might imagine from the crisscrossing effect, somewhere in the middle here you have to have valves and tubing and whatever to redirect food to the back tube and air through the front tube. And I'm assuming I'm getting that right. I may not be, because I'm not an expert in the field. I have, however, suffered an injury where it was probable I was going to have this done. And also I'm old enough, some of you are old enough, that you might have gone through the same first aid class where I was taught how to do a tracheotomy, which is really scary. We did it on a dummy. It was still gruesome. I'm legally, technically qualified to say I learned how to do it. I would not do it. This is not easy. But there was already a nurse and a qualified doctor doing that to this patient. What was the maxillofacial surgeon and oral surgeon from here up, not involving the voice box primarily, doing? He was, by his own statements that we can find, working on the leg of a patient who appeared to have no other injuries from here down, to put in the tubing in the leg, thighs probably, for putting in tubing to do all the other support care. This is support care, and he was at the leg end of the person, and the people working on his throat were working on his throat. Because when a person comes in, if they're having trouble breathing, you fix it. If their heart's not beating correctly, you hook them up to equipment to monitor it, and hook them up to equipment where you can literally slap a button to blast them to get the heart started back up. Keep the heart beating, keep the airway open. Keep them breathing. Everything else is not going to happen because in 3 minutes from either of them, nothing to work with. Another doctor, and one of many that came in after this moment, came in, examined the patient's head and said, "This is not compatible with life. Stop resuscitation. Stop what you're doing. There's no point." Because he, quote, now this is the description by Donald Teel Curtis, or Don T. Curtis as he's also known. The doctor got to the head end of this, where They weren't paying attention. They were just trying to get the airway open. They were just trying to get ready for putting tubes in the leg, getting all the prep work done. He lifted up the patient's head, turned it or whatever, examined the person's head, and came to the conclusion the condition of the patient is not sustainable. This person's going to die. No matter what we do, stop. The individual on the table had part of the brain missing. That's the only reason a person would do that, examining a head when the patient is still breathing and has a heartbeat. And the others are concentrating on establishing and maintaining those things. Let's move on. Dr. Donald Teel Curtis, at the time a doctor, later on just treated as a dentist, is quoted in 3 volumes out of 27 in a 20,000-page work from around that time. Volume, I'm using the number, not the Roman numerals. Volume 6, 7, and it looks like 14 out of 27 volumes, at least mentioned once, maybe more than once, with his testimony on the Warren Commission report for the President's Commission on the assassination of President Kennedy. That's not its actual name, but I'm throwing that together to get that out of the way. And yes, this was President Kennedy. That was the patient. Donald Teel Curtis did not make the evaluation and call, we're going to call it. He's not the one who had the authority to do that. He was the first year out of a 2-year residency, but that doesn't mean he's a newbie. This isn't his first day mopping floors or something. This is a maxillofacial surgeon, which means from here forward and from approximately here down. It includes eye sockets, depending on the training. Back in the 60s, they would have had a lot of overlap. This is not a brain surgeon, not a neurosurgeon. This is a surgeon whose primary job is to know about all of this here, the triangle of death, where anything that happens in here can kill a person. They have to have amazing amounts of knowledge because virtually everything that concerns your ability to sense things is in this cube of space beside your ears, and technically they involve those. Upper respiratory infections, eye socket infections can be included in this. The sinuses, knowing all the iggly bits and all that kind of crap. Okay? Not a moron, not an untrained person, not an orderly. This is a surgeon who works on the human skull, just in a way that's considered slightly lower tier according to some people. Okay, I'm getting that out of the way. Let's get that out of the way. After giving his information, Donald Teel Curtis said that he gave testimony as a witness to this. This is only what he's talking about. That he later said was either edited out, compelled, he was either encouraged or coerced into coming to a certain conclusion. Anything he said that was deviating from a particular pathway or conclusion or preconceived notion was deviated from. It would be deleted or he'd be admonished not to do it, put under pressure. This is a common refrain concerning this incident. And it is or is not, depending on how presented, valid. There's been enough people since then that said, yeah, they wanted it to come to a conclusion quickly, and there was a bunch of pressure on everybody. And I'm going to say something you don't like hearing. Donald Trump didn't force a release of all of the data when he was president the first time he was president, because he didn't. There was no reason to do that. The majority of it was released during Biden, not because of Trump. And to this day, some of it is still not released, and Trump could just force it. Just get that out of the way. Let's move on. Claims he said also was the posterior part of his head was blown out. Now remember, JFK was on his back. On video on the Zapruder film, you can see that the head, this front part of the head flew open, and then if you put him on his back, it's going to slap shut. It's going to have most of, not all of the skull there, or part of it. It will have a tendency of forming a shape that looks a lot like a normal skull, or just a slightly depressed, bashed-in skull. Autopsy photos were published first time in 1988, years later. 1993, the color photos came out. All of them are of profoundly poor quality, which is common if you're taking photos. Any of you who are photo geeks if you use film especially, you have to take dozens and dozens of photos to get maybe one or two that are good. And instead of just fixing the lighting in the room and doing everything needed, it's a hospital room and then eventually a morgue. They didn't fix the problem before it could be a problem. So we have really poor imaging. But it very obviously shows the front of the head is more damaged than the back, and there's a clear image of the back of the head having a very small puncture, not being blown out. But that could be done, because whatever. But if the back of the skull was blown out and then his head is placed on a framework to hold it up from here up, you would see something that very strongly indicates that the back of the head was blown out. I don't see that. Maybe you do. Some people will not even bother looking at this and come to the same conclusion because they need to have the shot come from the front. Even though the Zapruder film, which he was not privy to, Donald Teel Curtis did not see it at the time, shows very clearly the front of the skull coming forward, the head being thrown forward, and everything being thrown back. And reflexively, basal ganglia, because that was still inside of the brain pan, JFK pulled back, which does look to some people like a strike from the front. There is very little evidence of it being a shot from the front at all. I've come to this conclusion. You can come up with whatever conclusion you want to. The conclusion of the surgeon and doctor, whose primary learning is from at least the eye sockets down and from this part of the face forward, was that the back of the head was blown out. The majority of a brain being missing from a skull is evidence that the person is not salvageable, but can be maintained for tissue donor status these days. A person observing a patient laying down on their back, lifting up their head, and presumably not lifting up the tissue flap on the front to look in and see most of the brain's removed from the front of the brain, saying, this is not compatible with life, stop resuscitation, because this was a senior doctor who was relieved of needing to make the airway and relieved of needing to put in the tubing because these other people who were first responders, not lesser doctors and nurses, the first ones on site, the first ones at the patient, have to maintain blood flow, have to maintain breathing, have to maintain heart rate. They are not allowed to talk about anything else. Don't even look at them. Keep them alive. And you will hear that if you listen to some videos and even training recordings, which are available. Your primary purpose is to keep that blood pressure within range, the heart rate within range, and keep the breathing going. And if necessary, breathe for them by any means necessary. Because if you don't, they die in 3 minutes. But I don't want to hear about the leg. I don't want to hear about the skull being open. Because these days, a person with the skull blanked open, flapped open, survives most of the time. Back then, not so much. Zapruder frame 312 to 313 show head movement forward, blood matter and brain matter flying forward in a spray. He was shot from behind. Claiming otherwise is contrary to demonstrable available data, and then requires that you come up with a conspiracy theory about someone being there to record it exactly right. There are other video recordings, or more actually, film recordings, that show consistency with this, not absolute quality. Donald Teel Curtis, not being able to be at that end of the body to examine it immediately, may have come to the wrong conclusion, and that may be the most intense impression he had because he was working on the President of the United States who'd been shot in the head. Making a simple A versus B binary error like this is completely expected. My suspicion is Donald Teel Curtis made a simple mistake or error in judgment or perception and has never let go of it. But I don't know. Neither do you. He's in the news lately. The last time he was majorly in the news shows a spike on trends in 2012 or something. I don't believe he's exploiting the situation. I believe he simply was mistaken and obviously isn't changing his conclusion. And I wouldn't expect him to. From his perspective, that may have been accurate. Thanks for watching. Have a good day. Good luck with that. That's the only commentary I have on this. Someone requested it and then deleted their comment. Bye.